Dr. Reyes, internal medicine, obesity medicine here in North Texas. I want to talk about how I kind of coach my patients with GLP-1 receptor agonists and serum glucose transporter 2 inhibitors when they're in combination. Those two medications can result in significant weight loss and definitely help with weight control, but you got to be careful with those two medications. GLP-1 receptor agonists make you eat less of everything, and so if your carbohydrate levels go too low and then you're peeing out, making Kool-Aid in the urine with those serum glucose transport 2 inhibitors like Farxiga and Jardiance, then you can see it could be a setup for under-carbing or under-fueling, which could lead to problems. And so I teach my patients for signs and symptoms to look out for, especially with the GLP-1 receptor agonist. Sometimes you have to delay that dose. Sometimes we need to lower that dose. Same thing with the serum glucose transporter 2 inhibitors with Jardiance or Farxiga, is sometimes we need to back off of it. Sometimes you just got to get some extra carbs in the morning. I call it the inverted pyramid of carbohydrates, is what I recommend on my patients. And so just keep that in mind, that it does result, if initially someone is overcarbing, overeating carbs, and they get put on both medications, they'll have dramatic weight loss potentially, but that could set them up into a starvation mode, like if they're on the TV show Naked and Afraid, where they're not eating anything and they're just expending calories. And so you can see muscle loss in the long run because they're not exerting themselves. I hope that helps. Watch my other videos about watching out for a low carb state such as brain fog, and I will see you at the next video. Tubby Doc out.